I've been a physician for over 20 years. I've sat across from thousands of patients in their 60s, their 70s, their 80s, and I can tell you something that most doctors won't say out loud in a 10-minute appointment. The biggest difference between the patients who are still sharp, still strong, still living their lives fully at 80, and the ones who aren't, almost never shows up on a blood panel. It shows up at 6:47 in the morning, in their own bedroom, before anyone else is awake. I'm Dr. Leonard Brooks, and today I want to talk to you about 5 things your body does or doesn't do in the first few minutes after you wake up. Because after 3 decades of practicing medicine in this country, I've become convinced that those quiet morning minutes are the most honest health report you will ever get. More honest than your annual physical, more reliable than your cholesterol numbers. And the reason I'm making this video is because nobody is telling you this. Not your doctor, not the morning news, not the bottle of supplements on your nightstand. Now, before I get into the 5 signs, I want to ask you something. Have you ever wondered why 2 people can grow up in the same town, eat roughly the same food, live roughly the same life, and by the time they're 72, one of them is walking 5 miles a week and remembering every one of their grandchildren's birthdays, while the other one can't climb a flight of stairs without grabbing the railing? People want to blame genetics. They want to blame luck. But I've looked at the research and I've looked at the patients, and I'll tell you what the actual difference is. It isn't the big decisions. It's the small mornings. It's what a person notices and what they don't ignore. Here's what most people don't know about the first few minutes after they wake up. Your brain weighs about 3 pounds. 3 pounds, but it demands roughly a quarter of all the blood your heart pumps. Every single minute of every single day, it is hungry for blood. And after 7 or 8 hours of sleep, with no water, slow breathing, and your body lying horizontal, that blood has thickened. Not dramatically, but enough. Then your alarm goes off, and the most common thing people do, and I've told my own patients this and watched them look at me like I'm speaking a foreign language, is they sit up fast. They swing their legs over. They stand up. And they wonder why they feel dizzy. Here's why that matters more than most people realize. More strokes happen in the first hour after waking than at any other hour of the day. More cardiac events, more falls. That morning window is the most dangerous 60 minutes in a person's day after 60. And it happens in the quiet of your own home, not in a hospital, not with a doctor nearby. That's why what your body tells you in those first 5 minutes is so important. It's telling you the truth. Your job is to listen. The first thing I want you to check tomorrow morning, and I mean literally tomorrow before you brush your teeth, before you take a sip of water, is your mouth. Open it. Run your tongue slowly along the inside of your gums. Top, bottom, front, back. And notice one thing. Does saliva start pooling under your tongue within about 10 to 15 seconds? That sounds almost too simple. I know. But stay with me. Because what I'm about to tell you completely changed how I counsel my patients over 60. A healthy adult produces close to a quart of saliva every single day, not just water. Saliva is loaded with enzymes, with antibodies, with minerals. It is your mouth's first line of defense against infection, against bacteria, against inflammation. And when that production slows down, when the mouth runs dry, the gums become vulnerable in a way that most people never connect to anything serious. There was a large-scale study that followed over 1 million adults for 12 years. The finding that stopped me cold was this: people with chronic gum disease, bleeding gums, inflamed gums, receding gums, had a consistently and measurably higher risk of heart disease, stroke, type 2 diabetes, and dementia. Not a marginal increase. A significant, repeatable increase across study after study. And here's why. Your gums aren't a sealed barrier. They are a gateway. The bacteria that live around inflamed gum tissue don't stay put. Every time you chew, every time you brush, they slip into your bloodstream, and from there, they travel to the heart valves, to the lining of the blood vessels, to the brain. When I look at a patient who is aging well, and I mean genuinely well, sharp memory, good energy, clear skin, steady walk, and I ask them to open their mouth, almost every single time I find the same thing: pink, firm gums, a clean tongue, saliva that comes easily. That is not a coincidence. That is cause and effect. So here's what I want you to do. Tomorrow morning, before the toothbrush, run your tongue around your gums. If saliva pools quickly, that's a very good sign. Then brush gently and look at the bristles after. Look at the sink. No pink, no blood, no spots that ache when you press on them. Your body is telling you the doorway is closed. The bloodstream is protected. If you do see blood, even occasionally, even just a little, don't brush it off as brushing too hard. Bleeding gums are not normal after 60. They are inflammation, and small, repeated inflammation, morning after morning, year after year, is one of the quietest and most destructive forces in an aging body. One thing that has helped many of my patients more than any expensive mouthwash, a warm, saltwater rinse before bed, half a cup of warm water, a full teaspoon of salt, enough that you actually taste it, swish for 30 seconds, and then don't rinse it away. Let it sit on the gums while you sleep. It pulls bacteria out the way heat draws out a splinter. Patients who do this consistently for 2 weeks often tell me their gums stopped bleeding altogether. That's the mouth. And that's just the first sign. Now I want to talk about something that most of my patients are embarrassed to bring up, even after decades with the same doctor. Because in American medicine, we just don't talk about it enough. I'm talking about your bowel movement, specifically what happens in the first bathroom visit of the morning. I want you to think about the last time you went. How long did it take from the moment you sat down to the moment you stood back up? Was it 1 minute, maybe 2? And what came out? Was it soft, formed, well-shaped, and did the toilet paper come back nearly clean on the first wipe? If the answer to all of that is yes, I want you to understand something. That is not a small thing. That is one of the clearest, most direct windows into the health of your gut lining, your inflammation levels, your microbiome, and your overall digestive function. And most people your age are not getting it right. Here's what I see constantly in my practice, and it frustrates me every time. A patient comes in, tells me they've been trying to eat healthier. They started drinking prune juice every morning. They're having 3 servings of yogurt a day. They bought a fiber supplement that comes in a big orange canister. And then they tell me their stomach hurts by noon. They feel bloated all afternoon. And they still can't get a clean result in the bathroom. And I have to gently explain what I'm about to tell you now. Roughly 7 out of 10 adults cannot fully digest dairy after the age of 40. Not a little lactose sensitivity, genuinely cannot break it down. The lactose sits in the gut, pulls in water, and creates exactly the kind of loose, urgent, uncomfortable result that people then try to fix with more fiber drinks and more yogurt. It becomes a cycle. Prune juice does something similar, through a different mechanism. These are not health foods for an older gut. They are gentle laxatives in disguise. And if your gut is already working well, they are working against you. What does a healthy bowel movement look like at 65 or 70? Soft, formed. One smooth, easy effort. 1 to 2 minutes maximum. Nearly clean on the first wipe. That is the benchmark. And the foods that actually support that, without irritating anything in the process, are real foods in their natural form. A bowl of oatmeal with chia seeds stirred in, a ripe pear, a handful of berries with breakfast, a kiwi eaten with a spoon, spinach, lightly cooked, a sliced tomato with a little olive oil and sea salt. These are the foods that quietly build a clean, healthy bowel movement without creating inflammation or dependency. One more thing I'll add here, and this one surprises people. Do not sit on the toilet for 10 or 15 minutes. I know it feels like a good use of time. I know the phone is right there. But the human body was not designed to strain in a seated position for that long. People who spend 15 or 20 minutes every morning straining are doing real cumulative damage to the tissues in that region. Hemorrhoids, fissures, and prolapse, almost all of it traces back to 2 things: loose stool and too much time sitting and pushing. If nothing happens in 2 or 3 minutes, get up. Come back later. Your body will tell you when it's ready, if you've given it the right fuel. That's the second sign. Now look at your hands. Not the age spots, not the wrinkles, I'm not talking about cosmetic aging. I want you to look at your fingernails. Hold them up to a window right now if you can. A healthy nail on a person who is aging well has a smooth surface, a soft pink color underneath, no deep ridges running vertically from the cuticle to the tip, no horizontal lines cutting across. The nail like little speed bumps, no yellow discoloration, no brittleness at the tips that causes them to peel or chip off in thin layers. Why do the nails matter? Because the nails are one of the last places in the body to receive blood from the circulatory system, and one of the first places to show the consequences when something is off upstream. The nails are, in a very real sense, a slow biological record of your inner health over the past several months. Vertical ridges, those faint lines running lengthwise from the base to the tip, usually indicate the body is running short on certain vitamins and minerals. The fix isn't a multivitamin. The fix is getting real color onto your plate. Spinach, red and yellow bell peppers, sweet potatoes, eggs, blueberries, salmon. Food, not a pill. Horizontal ridges, lines that run across the nail, tell a different story. Those typically appear after a period of significant physical stress on the body, a serious illness. Sudden weight loss, a long stretch of emotional trauma. The body essentially paused nail growth to redirect resources to something more urgent. The nail became a timestamp, a record of what your body endured. Yellow, thickened nails, especially on the toes, often suggest fungal infection, but sometimes point to circulation problems or early thyroid dysfunction. Pale or white nail beds can indicate low iron or anemia, which in patients over 70 is far more common than most people expect. Brittle nails that split and peel frequently suggest low protein intake, and I see this often in older Americans who have, with good intentions, reduced their meat consumption without replacing that protein from other sources. The liver is your body's primary chemistry lab. When it's stressed, when it's missing something it needs, when it's working overtime to compensate for something elsewhere in the body, it sends a quiet signal outward, to the skin, to the hair, and especially to the nails. Learning to read that signal is one of the most useful things you can do. So tomorrow morning, after you wash your hands, take 10 seconds before breakfast and really look. Hold both hands up to a window. Compare your two thumbs side by side. Is the color even? Is the surface smooth? If the answer is yes, pink, smooth, no ridges, no peeling, that is a quiet victory. It means your body is feeding itself well from the inside out. Keep eating your eggs. Add a small handful of walnuts or almonds. Pair your leafy greens with something acidic, lemon juice, a splash of vinegar, sliced tomato, because the vitamin C dramatically improves how much iron your body actually absorbs from that meal. That's the third sign. Now, I want to stop for a moment and point something out, because I think it's important. The mouth, the bathroom, the nails, 3 completely different parts of the body, 3 different organ systems, and yet every single one of them is telling you the same underlying story about your circulation, your inflammation levels, your nutrient status, and your blood quality. The body is not a collection of isolated problems. It is one continuous system, and after 60, the parts that were always whispering to you start to speak a little louder. The question is whether you're listening. The next 2 signs I'm about to share with you are the loudest of all. Tomorrow morning, when you swing your legs off the side of the bed and put your feet on the floor, stop. Don't stand up immediately. Sit for a moment. Let your body arrive. Then stand and take your first 3 steps. I want you to pay careful attention to what happens in those 3 steps. Do both legs feel solid? Does each foot lift cleanly off the floor? Is your weight distributed evenly on both sides? Or does one leg feel a little heavy, a little sluggish, a little slower to respond than the other? I want to tell you why this question matters as much as anything in this video. Your legs are the farthest point in your body from your heart. They are, in medical terms, the territory that gets served last. If blood pressure drops, if a vessel narrows, if circulation is compromised anywhere in the chain, the legs are the top floor of the building, and the top floor is where the water pressure drops first. There is a large body of research following older adults across the United States and Europe. And one of the most consistent findings across those studies is this: a significant portion of people who eventually experienced a stroke reported in the days and weeks before it happened a strange sensation in one leg, not pain, not a cramp, just a vague heaviness on one side, a foot that caught on a threshold it had never caught on before, a shoe that seemed to wear out faster at the toe on one side, a slight drag, a slight lag on just one leg. Almost all of them explained it away. I slept on it funny. I've been sitting too long. I'm just tired. And then one morning, it wasn't a small thing anymore. Here's the neurological reason this happens. The left hemisphere of your brain controls the right side of your body. The right hemisphere controls the left. When a small blood vessel deep inside the brain begins to narrow, long before it ever closes completely, the motor signals it sends down to one leg get slightly weaker, slightly less precise. The leg still works. It just doesn't feel quite right. And that vague asymmetry, that one-sided heaviness, is your brain attempting to communicate something while there's still time to act. So tomorrow, take those first 3 steps slowly. Ask yourself, are both feet lifting evenly? Am I favoring one side without meaning to? Can I walk a straight line down my hallway without drifting? If the answer to all of those is yes, both legs feel like yours, both feet are responding the same way, both sides feel balanced, that is one of the most reassuring signs on this entire list. It means your brain's deep vessels are open, the signals are reaching their destination, your nervous system is intact. If something feels off, and especially if it comes and goes, please do not wait and see if it resolves on its own. In medicine, we have a name for an episode where a leg or arm feels weak or numb for several minutes and then returns to normal. It's called a transient ischemic attack, a TIA. And the statistics around it are sobering. 3 out of 4 people who experience a TIA will have a full stroke within 3 months, half of them within 48 hours. The body is not whispering at that point. It is shouting as loudly as it knows how. And the window in which doctors can intervene and prevent serious permanent damage is small. Please take that seriously. That's the 4th sign. Now I want to tell you about the last one, the most important 60 seconds of your morning. This one takes no equipment, no lab work, just a mirror. Walk to your bathroom mirror. Look at yourself. And before you do anything else, before you wash your face, before you reach for the toothbrush, smile. A real smile. Show your teeth. And look closely at what happens. Do both corners of your mouth lift at the same time, with the same amount of effort, or does one side pull up naturally while the other side lags just slightly, just a fraction of a second behind, or doesn't rise quite as high? Look at the crease that runs from the side of your nose down to the corner of your mouth. Is it the same depth on both sides, or is one side a little shallower, a little less defined than the other? Now stick your tongue straight out. Does it point directly at the center of your reflection, or does it drift, even a little, to one side? Now say something out loud. Your name, the day of the week. A simple sentence. Today is a good day. Listen to your own voice. Are the words coming out cleanly and clearly? Or does one corner of your mouth feel just a little heavy? The consonants a little soft? The speech a tiny bit slower than it was yesterday? This 60-second exercise in front of your bathroom mirror is, in my clinical opinion, one of the single most valuable things a person over 60 can do every day. Here's why. The muscles of your face, the corner of your mouth, the tip of your tongue, the dozens of tiny muscles that shape every sound you make, are controlled by some of the most delicate, most sensitive nerves in the entire human body, and those nerves are fed by some of the smallest, most fragile blood vessels in the brain. When something begins to go wrong in those vessels, when even the earliest, most subtle change is occurring, it almost always shows up here first, before your speech is obviously slurred to anyone else, before your leg stops working, before anyone around you notices a thing. You see it in your own reflection. In that fraction of a second when one corner of your smile doesn't quite come along for the ride, if both sides of your face lift symmetrically, if your tongue goes straight forward, if your words come out clean and even and effortless, I want you to take a slow, real breath of relief, because that balanced reflection in the mirror means the most fragile, most critical vessels in your brain are open. The control center is online, the wiring is intact, and at your age, that is not a small thing. That is one of the strongest indicators of genuine brain health that exists, stronger than many tests I can order from a lab. If something looks different, if something is new, even slightly, even something you could talk yourself out of. Do not wait until tomorrow. In a stroke situation, the window in which physicians can stop the damage and reverse it is approximately 4 hours wide. 4 hours, that's the whole window. After that, the damage is permanent. So this mirror test is not a curiosity. It is a 60-second early warning system that could, without any exaggeration, be the most valuable minute of your day. 5 signs: mouth, bathroom, nails, legs, mirror. That's the whole list. And if you woke up tomorrow morning and none of those signs were there, not one of them, I want you to understand what that actually means. It means your circulation is reaching the very edges of your body, including the tips of your fingers and the floor of your mouth. It means your inflammation is low. It means your nervous system is sending clean, complete signals from your brain to your extremities. It means your gut is balanced and your blood is clean enough to nourish the smallest, most distant vessels in your body. That is not luck. That is not genetics. That is a body that has been quietly, consistently maintained by small daily choices that most people don't even realize they're making. Now let me leave you with 3 habits, not a supplement protocol, not a new diet. 3 simple habits that cost nothing and that you can complete in the first 30 minutes of your morning. The first one is the one I fight hardest to get my patients to actually do because it sounds almost too simple. Before your feet touch the floor, lie still for 5 minutes. Wiggle your fingers, wiggle your toes. Take 5 long, slow breaths in through the nose, out through the mouth. Then roll to your side, push yourself up gently with your arm, and sit on the edge of the bed for 1 full minute before you stand. Just 1 minute. That single minute, sitting, breathing, letting your blood pressure stabilize before you ask your body to change altitude, prevents more falls and more morning cardiac events than most medications I could prescribe. That is not an exaggeration. That is physiology. The second habit is a glass of warm water. Not cold, not a big iced glass from the refrigerator. Body temperature, around 80 to 90 degrees, about 8 ounces, sipped. Slowly over 5 minutes. Your blood has been thickening all night. That warm water is the first thing that begins to thin it back out, to get it moving freely again. Hold off on the coffee for 10 minutes. Hold off on the orange juice. The sugar hits a fasted body too hard first thing in the morning. Just warm water, slowly. It is the cheapest, most underused medicine in your kitchen. The third habit is the one that surprises people most coming from a doctor. Before you check your phone, before you turn on the news, before yesterday's problems come rushing back in, sit near a window for 1 quiet minute. Look at the light. Take 3 slow breaths, and think of one thing, just one, that you are genuinely grateful for this morning. I know how that sounds, but I am not talking about feelings here. I'm talking about biology. When the first thing your brain processes upon waking is stress, an alarming headline, a difficult text message, the weight of a worry you fell asleep with, your cortisol spikes, your blood pressure climbs, and those small, fragile blood vessels we've been talking about this whole video constrict. The most dangerous morning window just got more dangerous. When the first thing your brain processes is calm, even 60 seconds of genuine stillness, of one simple, grateful thought, the whole cardiovascular system responds differently. The vessels stay open, the heart stays steady, the morning becomes yours. Warm water. 1 slow minute before you stand. 1 quiet moment of gratitude before the noise begins. That's it. That's the whole prescription. I've been a doctor for a long time, and I've learned that the patients who age the best are almost never the ones with the most money, or the strictest diets, or the most exotic supplements. They're the ones who learned, somewhere along the way, to pay attention, to notice the small things their body was showing them, and to take those signals seriously while there was still time to respond. 5 signs: mouth, bathroom, nails, legs, mirror. Tomorrow morning, run through each one. It will take you 3 minutes, and if every single one comes back clean, if you pass all 5, I want you to smile at yourself in that mirror and mean it. You've done something right. You are aging better than most, and most people around you will never know it. If this was useful to you, please leave a comment and tell me how many of the 5 signs you woke up without. I read everyone. And if you have someone in your life, a spouse, a sibling, an old friend you've been meaning to call, who is in their 60s or 70s or 80s, please share this with them. It could easily be the most important 3 minutes of their week. Take care of yourself tomorrow morning. I'll see you in the next one.